Hi there. Welcome to Anonymity 1D. My name is Dave. I have type 1 diabetes. This is my daughter, Brooke.
My name is Miguel. I have type 1 also.
I am Miguel's dad, Alex.
And my name is Matt, a diabetes educator. In this video, we go over how to treat hypoglycemia. Please remember that this is for educational purposes only and is not meant to replace your doctor or care team.
Miguel, are you feeling all better now?
I am, thank you. Are you okay too?
Yes, my sugar is now stable.
Dad, how come you checked Miguel's blood sugar with a meter even though his sensor already said he was low?
Sometimes you can feel low even though the blood sugar is fine. Other times, the sensor reads low but I don't have any symptoms. So, I double-check my blood sugar before treating a low.
That's a good point. It's not a good idea to rely just on symptoms. For example, if your blood sugars are usually in the 200 to 300s, even a 100 may feel low. Similarly, sometimes sleeping on a sensor can cause what is called a compression low. So, it is a good idea to double-check your blood sugar with a meter before treating.
So then, how does Dad or Miguel know when to treat a low blood sugar?
We recommend treating a blood sugar of less than 70 milligrams per deciliter, which is 2.9 millimol per liter. The 15-15 rule is used to treat a low blood sugar. This means giving 15 grams of carbs and rechecking the blood sugar in 15 minutes. Use a glucometer and not a CGM to monitor his sugars, as the CGM readings can lag and not reflect the situation accurately. The blood sugar should increase by 54 to 70 milligrams per deciliter or 3 to 4 millimol per liter, with a target of 100 milligrams per deciliter or higher. If there is no response or inadequate response, repeat the steps. Once it is in target and Miguel won't be eating soon, you should give him 15-gram carbs along with either some fat or protein to ensure that the sugar doesn't dive back down again. Don't give insulin for this snack.
Talking about snacks, let's get something to eat and then continue this conversation.
The 15-15 rule is just a starting point. You may find that Miguel needs less than 15 grams of carbs, or he needs a longer time to respond. Over time, you will learn how to change that. A few factors that affect that are: how low is the blood sugar? Milder events may need less carbs, like 10 grams. The age matters too. Younger children tend to need less carbs than adults. The cause for hypoglycemia also plays a role. Ongoing events like exercise needs a different approach versus a low because of too much insulin at the last meal. You also need to consider how the diabetes is managed. For folks using a hybrid closed loop, the algorithm itself may be working on correcting the low sugar, so you may need to be less aggressive with correcting the low, or sometimes not treat it at all. There is one more factor that affects low blood sugar management: the kind of carb that you use. There are different kinds of simple sugars like glucose and fructose, but glucose has a more significant impact on blood sugar and is therefore important in treatment of hypoglycemia. Glucose tablets and glucose gels have only glucose, so they cause a rapid rise in blood sugar levels. Fructose is found in fruits, fruit juice, honey, and agave. They do have some glucose. It needs to be digested, and only a fraction is absorbed. So, unlike glucose tablets, it takes longer and you need more to cause a rise in blood sugar. Sucrose is a double sugar containing equal parts of glucose and fructose. This is found in white and brown sugar, maple syrup, jelly beans, gummies, candies, and regular soda. It is important to remember that diet soda should not be used to treat a low. Again, only the glucose affects blood sugar, so the amount of sucrose needed to correct a low sugar can be more than what you use with just glucose. Here are some examples for getting 15 grams of carbs with these options.
That sounds about right. My low treatment regimen changed over the years. When I started on the hybrid closed loop, I needed to really cut back on how much carbs I needed to treat my low because the pump was already cutting back quite a bit on the insulin.
Wow. I didn't realize there is so much to treating low sugars.
It sounds like a lot, but with time you will learn more about Miguel's diabetes. Dave, what do you use to treat your lows?
I carry juice boxes. There are some brands that have the exact amount of carbs I need, so I make sure I have those handy. Another option is candy, as they are easy to carry. Though glucose tablets are convenient and work faster, I don't like the taste, so it's not my first choice. And then for a snack, I carry a specific brand of granola bars, which work the best.
I tried those glucose tablets and they were too sweet.
Why do you need a snack after correcting the low?
That is to prevent the blood sugar from falling again. The low treatment options like glucose tabs and juice raise the blood sugar rapidly, but they are fast in and fast out, so the blood sugar will drop. If I am going to eat soon, that meal will help keep my blood sugar up, but if the next meal is not for a few hours, I take a snack with carbs along with some protein or fat to sustain my blood sugar.
Now, this is how you treat hypoglycemia if Miguel is awake and able to take carbs. If he is not awake or not able to eat or drink, then you cannot use this regimen. If there is any impairment in brain function like grogginess, coma, or seizures, assistance is needed to give carbs, or other methods are required to correct the low sugar that is called severe hypoglycemia. This can happen at any blood sugar level. If Miguel is unable to take carbs, you need to use Glucagon to correct the low sugar.
I saw the Glucagon among Miguel's prescriptions, and I have been curious about how it works. Can you explain that?
Sure. Glucagon is a hormone that works like a key. It releases glucose that is stored in the liver to raise the blood sugar. There are a few different options for how it is given. There are two options available: an intranasal option, which is sprayed into the nose, and a ready-to-use injectable option, which is injected into the muscle. Both work well. You just need to make sure you are trained on how to use it.
So, does Dad need to give me that injection if my blood sugar goes too low?
The blood sugar number does not decide if your dad needs to use the Glucagon injection. It depends on if you are awake and able to take carbs. If you are awake, then he can give you juice or candy to bring your blood sugar up. Alex, it's good to know that Glucagon can cause nausea and vomiting. If the hypoglycemia is severe enough for you to use Glucagon, then definitely call the diabetes team to see if Miguel needs to go to the hospital for further care. Once you fix the low, the last step is to try and find out why he went low in the first place. A good place to start is looking back at the previous 3 to 4 hours at least to see what he ate, whether he got any insulin, exercise, etc. The diabetes team can help with that.
Matt, thank you so much for your help with all this. Let me make sure I got the high points. If I am uncertain, I should double-check Miguel's sugar with a glucometer before fixing a low blood sugar. Use the 15-15 rule to begin with, but that may change with time. The carbs used to treat a low can affect how quickly the blood sugar rises. Once his sugar is above 100, treat with a snack with carbs or protein to keep his blood sugar from dropping again. If he is not responding or cannot eat or drink, I should use Glucagon. In that case, I should call the clinic so they can tell me if he needs to go to the hospital. Once the low sugar is corrected, I should try to look back to see why he went low in the first place to prevent it from happening again.
You got it. Other tips about hypoglycemia are: always have Miguel's devices like his CGM, glucometer, and low glucose treatments with you. If he does get symptoms when his blood sugar is low, have him be aware of them and let you know so you can check his levels. Make sure he wears an emergency medical ID, especially when he gets older.
Matt, thank you for the refresher. This was very helpful for me too.
We hope this gave you a better understanding of how to manage hypoglycemia in type 1 diabetes.
Please remember that this is for educational purposes only and is not meant to replace your doctor or care team.
Don't forget to like and subscribe to our channel. Thank you for watching.